22nd that says they're going to slash the payment rates to hospitals so much that some hospitals may stop taking Medicare. So what kind of a benefit is it if your hospital won't take Medicare?
And let's talk about the doctors out there and how they're going to react. I think a lot of people out there don't even want to be in the business of providing medical services anymore. There's concerns there won't be enough primary care physicians to actually take on the new patients that will be added.
Right, but getting to the lies. A lie here on page 3 of the pamphlet says that they're slowing down the spending in Medicare so that the Medicare Trust Fund will be there longer for seniors. That's a lie. They're actually taking the money out of the Medicare Trust Fund and shifting it over to Medicaid. They're not going to make Medicare last longer. They're giving the money to somebody else. They're robbing seniors.
Right, and so when you look at this, you know, the Republicans have talked about changing this and maybe taking the law away entirely. There's a movement afoot right now to get rid of this law. Can it get any traction? I know you talked to lots of real people about this.
I'm quite confident. I'm quite confident for 2 reasons. First of all, this law tears up your constitutional rights, and 20 lawsuits have already been filed challenging the constitutionality of this law. And with the Constitution on our side, freedom will prevail.
Well, we know that 60% of folks out there, they're saying, we don't want this law. We don't like this law. So there's really some momentum behind it. Can this tour that the president's doing have any kind of impact on public sentiment? You know, it's not like you're selling toothpaste here.
I believe people will see the truth. For example, this brochure says that people on Medicare will have more control over their health care. In fact, they will have less. They will no longer be able to decide for themselves when to see a cardiologist.
Well, you know what I think is interesting about that brochure, too? It was paid for with $18 million of government money.
Government is becoming a lie machine, and they're using our dollars to do it.
Well, you know, I know you're going to be all over this topic. This is something you're very interested in. I want you to keep an eye on whether we're making the kinds of changes, if we do get to changes, that you think are important. Is there a 1, 2, 3 list you want to see?
Absolutely. We could improve health insurance in this country in a 20-page bill that members of Congress could actually read before they pass it.
What would it do, Betsy? What would be the
changes? It would allow
changes?
people to buy health insurance across state lines. New Yorkers, for example, pay sometimes 5 times as much as somebody in California for the same health plan because of our ineffective laws here. It would create high-risk pools so people who do have pre-existing conditions could still get health insurance.
So you would have some heart as well as some fiscal restraint?
Absolutely. We would have medical liability courts so that people who are truly injured get a fair deal, but doctors aren't dragged through the court system with unfair verdicts and very costly insurance as a result. And we could extend that COBRA so that people who are laid off, industrious people who are between jobs, could afford those premiums till they get another job.
Well, it sounds all very much like a great idea. Betsy McCaughey, thank you so much for coming on our first show. We really appreciate it.
Congratulations.
Thank